Hi, my name is Scott Austin, here to talk to you today a little bit about wearables and COVID-19. More specifically, I'd like to talk to you about how we can use commercial off-the-shelf devices to help keep our workforce safe in a pandemic environment. This is my sister-in-law, Angela. She is single, she is taking applications, and she is a bit of a workout enthusiast. As part of that habit, she wears a wearable device to track her fitness, and in November of last year, Angela got COVID. What's interesting about that is that Angela's wearable knew that she had COVID before she did. You can see on the screen that there were certain increases in certain physiological markers that Angela couldn't even feel, but the wearable was able to detect, letting her know that she probably needed to go get tested. Those physiological markers, probably the two big ones that are the most important, are respiratory rate and heart rate variability. See, with a lower respiratory infection like COVID, we have increases in respiratory rate and corresponding changes in heart rate variability as our systems try to catch up and try to deal with the infection as it's affecting the rest of our body. And by seeing the data that's picked up by the wearables, we're able to know that our body's dealing with something far before we can actually feel it. Now, back early last summer, I wrote a short article in which I had the idea that a few wearables judiciously stationed on the wrists of our personnel might, at a small expense, be made useful sentinels of our health. And a lot has happened since then. In particular, studies across the country, everywhere from California to Mount Sinai, Stanford Medicine, have all confirmed the basic premise of that idea, the idea that these wearables can be used on our workforce to detect these changes, and they perform even better than I realized at the time. These studies are confirming that these changes can actually be detected 4 to 7 days before subjects feel any symptoms or have any idea that they might be getting sick. So these studies are encouraging, but the one I'm probably the most excited about is actually from the Defense Threat Reduction Agency and the Defense Innovation Unit. They've been sponsoring the RATE study, and their, again, premises, they want to use these devices as sort of a check engine light. They don't want to diagnose anybody, but they want to have some sort of tell so that we need to get these people out of the greater workforce and get them looked at to keep the infection from spreading. Now, these devices don't present any type of silver bullet. What they really are is just one more tool in our ability to kind of try to block the Swiss cheese model to keep those holes from lining up. They work well with things like social distancing, masks, and vaccines, which is a subject I'm glad you guys are bringing up. The idea there being, some people would think we've already made it to the point of having folks vaccinated. Do we really need to worry about that? Do the wearables have a role to play? And the answer is actually yes, because wearables have another benefit that they bring to the table in the form of behavior change. They're actually shown to be quite effective, especially in the short term, in helping people change their behaviors. This becomes very important in things like sleep, and sleep's role, which is very well established within the effectiveness of vaccines. We've seen studies for more than a decade that show that people that are sleep deprived and then get a vaccine, that vaccine is actually up to 50% less effective than it is if they are well rested and in good standing. So that's just another benefit that these devices could bring to the table in a pandemic environment. So if that's all true and we have this opportunity, the next question is, how does a military organization like this, like the Coast Guard, roll out a program like this? We have the ability to just issue these devices out and mandate that people use them. But whenever I was looking this back last summer, I thought there were certain challenges, social and political, that made that kind of untenable. I didn't think that was a good idea. You have the whole Big Brother idea, the fact that people are going to be looking at your information. And I thought that giving people something that they didn't have a choice in would not be an effective program. I thought that we should probably use a program much like the NBA's program that used wearables during COVID. They basically issued those in the NBA bubble, and they gave people the opportunity to choose whether they wanted to use them, and then if they wanted someone else to be able to monitor their information or not. But then those ideas are based on a basic assumption that exists in most of our technology acceptance models. And that assumption is that the user has some choice in the end, whether or not they adopt that technology. But a lot, again, has happened in the last year, and the pandemic environment has given us a giant test bed of data to look at in which technology was thrust upon populations. The fact that we're doing speeches and studies like this on Zoom in an environment that none of us wanted to be in probably a year ago, but we've all adapted to, gives us a whole new outlook and a new field that we should probably be looking into. That's why I think the next step in this process is really to look at what type of variables that we can adjust and that we can control would help make an effective policy that would help wearables be adapted by our workforce, whether that's making them mandatory or voluntary or gamifying their use to try to get our people to actually use them in a way that they see a benefit. Because if we can do so, I think that these can be just one more tool that will have benefits not only in a COVID and a pandemic environment, but for things like risk assessment, health assessment, and resilience that could span for years. I appreciate your time, and thanks for tuning in.